Yeah.
But one point I had, and I was thinking was, not for nothing, we are walking this kind of tightrope with patient communication, where I think the community seems to be going a really good direction in that there's a lot of chatter of like, don't stop BSing patients. If you don't know, say you don't know.
Mm-hmm.
That said, you can't say like, hey, why does it feel like it pinches up here? And then I go, well, based on your provocation pattern, it pinches there. Like I have to have some, you know what I mean? It's a little bit more of an esoteric point, but again, you need to be able to communicate. Well, you've got your clavicle here. This is your AC joint. As the shoulder comes up, the space closes down. This, that, and the next thing. You got brachial plexus, the nerves. Maybe it is important to not BS, but know well enough to go. Here's again why I think to give you something you're going to feel some level of confidence. Well, this is an answer that's going to set you confident.
And I think it's important to say like our education is still in process, right? Like we don't know everything, but it is important to be able to have a way of communicating what we want our clients to do, right? And that's going to be different for different clients, but a big part of that is just demonstrating the movement of the joints, right? It doesn't necessarily have to be diagnosis based, but I think it should be movement oriented because that's what we're asking someone to do. We're asking them to move in a different way. So a really good way to do that is to show a model of what's going on inside the body, whether it's, the bones moving. We all have these models in our clinic, or even just, pulling up anatomy apps and just showing like, here is the relationship between this muscle and this muscle. When you shrug your shoulder up, and I don't want you to do that, these are the muscles that are more involved, and this stuff under here is where I really want you to feel. Like, so that could be helpful because that could be practical for them. So it's like, oh, okay, like I want to feel this, I don't want to feel that, right? Because how does a person know that they're doing what you're asking them to do? Like that's ultimately the ongoing process that we're trying to get out of someone, to get them more aware of their movement patterns, to get them aware of the difference between something that might be provocative and something that would be different than what they're accustomed to doing. So having an internal idea of what's going on inside the body could be huge, but it doesn't actually have to link to like a herniated disc or a rotator cuff tear, but it can, if that's what they're coming into. It could just be like, this is what the people mean when they say herniated disc. This is what people mean when they say rotator cuff tear. These are the rotator cuffs. Like all of that, I think is really valuable, because if you think about the way you train, and I think about the way I train and what I feel in my body, I use my knowledge of anatomy and kinesiology and everything I've learned over the years to know, like, is something safe or is something unsafe? But I don't necessarily look at pain, like feeling pain, as something that, oh, I must be damaging something. And that is also part of the education of just over the years of like learning about pain science and things like that. So the more that we can educate people to be on a similar page to where we are, understanding that we have still a lot to learn, we're probably going to help them get more control over their body. And that's really important if we're trying to get them to change the way that they're doing something.
Yeah. And I think that knowledge and control point is a really important point, because I have two thoughts here, and one's kind of silly, but again, I find that a lot of these like variables I've come across are these very human silly moments, and so what comes to my mind is like, there's nothing worse than hearing a funny joke or hearing like a stand-up bit just now, and then you try to think of it in your head, and like halfway through you're like, this is not funny, and I sound like an idiot, and I've gotten 60% of this set up wrong. As silly as it is, like I think there's a version of that in terms of a patient trying to communicate their understood version of the diagnosis to a spouse, to a parent, to a whatever, and there are these situations where they kind of go home and like, I was trying to, okay, so ready, my husband asked me what, and I something the muscle, what I mean, like that moment happens, without being able to provide like a concise, knowledgeable, knowledgeable enough that it is succinct and simple, explanation. That's number one. And that moment, I think, or not does, but can get in a patient's head where they're like, I left here and I thought I knew, but like, do you know what you're talking about? Because I could not explain
Right.
that kind of thing. And then the other thing is, I think of protraction with what you were talking about, because there's a certain, ability to monkey see, monkey do. And I think we've all had those patients where they go, my hip feels great. I wake up in the morning and I do exercises for about 2 hours. And if I don't, all hell breaks loose. But, and I think, the shoulder, there's certainly this thing of like, shoulders back, good, shoulders back, forward, bad, right? And if you as a provider have not communicated, like, okay, you got this bone that floats around, and sometimes you need to create all these, this cuff down here so that you can reach, you can go overhead, you can whatever. There are times where you need to get stronger and rolling that shoulder forward, and they can't picture the scapula, and they can't picture how the then you do get this almost ritualization, right? Of like, it's back. I'm going to grabbing the Christmas presents, but I got to be back. Wait, shoulders. You know what I mean? Like that can happen again without knowing the anatomy well enough to provide those explanations.
Yeah, I would agree, and I think that's more of a more modern thing that patients come in with is they have knowledge now, but the knowledge is like over exaggerated in a direction, right? So, and it's the idea of posture being like pull your shoulder blades back, tuck your chin as much as you can. So we definitely need to be able to explain our idea of what we're trying to get out of people and the pros and cons to what they're doing. I think it's important to always shape things as pros and cons, though, and not like that's good, that's bad. And that's, to me, just movement relationships or bodily relationships. So the education that I think we're trying to get as movement professionals is not about like what's right, but just getting more relationships of the body that are consistent, right? And so that we can explain it in that way, in a sort of non-judgmental way of saying, okay, when you do this, this will have positive effects for these things, but lead to this down the line, which is part of what you might be feeling right now, right? And it's always going to be based on what you're feeling right now, not based on some guess in the future of saying like, oh, you're going to have pain if you keep doing that. Like, I don't find that to be entirely useful. And I think that's part of like the discussion question we were having about, form and technique when it comes to powerlifting and things like that, where, there's an idea of what we're trying to see from people in good technique. But like, as you really break it down and you think deeper on it, there's not like a good or proper form. There's just like what people can and can't do. And there's an understanding of the relationships of the body. But I think when we can have an awareness that way, where we're not trying to judge things and we are really open to saying, okay, this is what you're doing and this is what you're feeling. Here might be a way that we can give you more control of changing what you're feeling by thinking a little differently about this, right? But also maybe giving them a little bit of credit for saying, okay, yeah, like that's not a bad thing to do in these circumstances. So you're just expanding their education, but instead of saying, oh, don't do that, like you're going to break yourself, because that just creates more of this mentality that they are fragile in many ways.